Let us now see epilepsy. Difference between seizure and epilepsy. What is seizure? First of all, we have to understand. If we are learning about epilepsy, we have to differentiate from seizure, first of all, and this is a very critical concept. Both of these things are distinct. Accurate diagnosis is important to avoid underdiagnosis and overdiagnosis. If we underdiagnose, the patient will suffer. If we overdiagnose, then there will be misleading with the stigma and unnecessary long-term medication will be given. First of all, let us see what is seizure. It is not just any abnormal electrical activity in the brain. It requires a specific definition. It is an abnormal electrical activity in the CNS, and that abnormal activity must result in abnormal motor experiences, abnormal sensory experiences, and abnormal psychomotor experiences. Motor, sensory, and psychomotor experience. And what is epilepsy? It is characterized by recurrent tendency to develop seizure. रिकरेंट बार बार हो रहा है, सीजर हो रहा है, मतलब कि मोटर सेंसरी साइकोमोटर एबनॉर्मल एक्सपीरियंस हो रहा है, और दैट इज ड्यू टू एबनॉर्मल इलेक्ट्रिकल एक्टिविटी इन द सीएनएस. और ये रिकरेंट जब होता है, इट्स रिकरेंट टेंडेंसी इज एपिलेप्सी. सो इट इज एबनॉर्मल स्पॉन्टेनियस एंड रिकरेंट टेंडेंसी फॉर एबनॉर्मल इलेक्ट्रिकल एक्टिविटी इन सीएनएस क्लिनिकली मैनिफेस्टिंग एज सीजर्स. अब सीजर के की पॉइंट्स देखेंगे. नॉट ऑल एबनॉर्मल ब्रेन एक्टिविटी लीड्स टू सीजर. सारी की सारी एबनॉर्मल ब्रेन एक्टिविटी सीजर कॉज करेगी, ऐसा नहीं होता है. अ सीजर इट इज अ क्लिनिकल इवेंट दैट कॉजेस ऑब्जर्वेबल और एक्सपीरियंस्ड फिनोमेना. एबनॉर्मल इलेक्ट्रिकल एक्टिविटी मस्ट लीड टू दीज एक्सपीरियंसेस. If the activity occurs but isn't perceived or doesn't cause an experience, it's not a seizure. मतलब ये एक्टिविटी हो रही है, abnormal एक्टिविटी हो रही है, लेकिन इसको परसीव नहीं किया जा रहा, इसका कोई एक्सपीरियंस नहीं हो रहा, लाइक ये सारे, तो उसे सीजर नहीं बोलेंगे. अब ये डिस्टिंक्शन देखेंगे between seizure and epilepsy. A single seizure does not equal epilepsy. Epilepsy involves tendency for seizures to reoccur. Most brains can develop seizures under pathological circumstances like severe hypoglycemia, electrolyte imbalance, CNS stimulants, but this doesn't make them epileptic if the tendency isn't recurrent. Let us see now types of seizures. Psychomotor experiences. These involve complex changes in behavior, emotion, memory, and perception, often linked to temporal lobe and limbic system. कॉम्प्लेक्स चेंजेस हो रहे हैं बिहेवियर में, इमोशंस में, मेमोरी में, परसेप्शन में, और ये टेम्पोरल लोब और लिम्बिक सिस्टम से एसोसिएटेड है. टेम्पोरल लोब एपिलेप्सी देखना है अभी, उसमें क्या क्या आता है. It is closely associated with primitive functions, olfaction, taste, emotions regulated by the limbic system, which works with temporal lobe. Then memory, particularly recent memory involving the limbic system. Sexual behavior controlled by limbic system and temporal lobe. Species survival and perpetuation. Functions like smelling, eating, reproduction are linked to limbic system and temporal lobe. Differentiating fantasy from reality. This crucial function, which develops as we mature, is governed by the temporal lobe. Sense of familiarity, recognizing familiar, unfamiliar people and places. Starring spells epileptic twilight state. Sudden staring in a particular direction, often due to abnormal firing in the frontal eye fields, causing conjugate eye deviation. Seizure versus epilepsy का recap देखेंगे. Seizure event caused by abnormal electrical activity in CNS manifesting abnormal motor, sensory, psychomotor experiences. Epilepsy condition characterized by intermittent, spontaneous, recurrent tendency to develop seizures. It is vital to distinguish between a single seizure and the chronic condition of epilepsy to ensure proper diagnosis and treatment, avoiding unnecessary suffering and stigma. Now let us see types of seizures. Motor experiences वाले देखेंगे. Seizures can manifest as these all, and among them motor seizures. उनमें tonic seizures हो सकते हैं, clonic seizure, tonic-clonic seizure, atonic seizure और myoclonic seizure. Tonic seizure में simultaneous firing of agonist and antagonist muscles, causing body to stiffen. Respiratory muscles can be affected, leading to cyanosis. Clonic seizures alternating firing of agonist and antagonist muscles, resulting in jerking movements of limbs. Tonic-clonic seizures, combination where body first stiffens, clonic phase, followed by jerking, clonic phase. Atonic seizure, sudden loss of muscle tone, causing person to go limp or collapse like a lump of meat. Myoclonic seizures, sudden brief jerks of a part of the body. These are single jerks, unlike the repeated jerks in clonic seizures. Differentiation from chorea. Myoclonic seizures are typically intermittent or occur once in a while, whereas chorea, like Huntington's or Sydenham's chorea, is continuous movement. Sydenham's chorea is typically seen in individuals under 30 years old, rheumatic chorea, or Huntington's chorea is typically seen in individuals over 30 years old. Now the sensory experiences, let us see. Sensory seizures. There is abnormal electrical activity in the sensory cortex area. Sensory seizures can be characterized into somatic sensory experience and special senses. Somatic sensory experiences are abnormal sensations in the body like burning, tingling, or pressure without an external cause. This can occur if sensory cortex is involved. Example, parietal lobe. Special senses, visual flashlights of light patterns or more elaborate visual scenes due to abnormal activity in the occipital cortex, visual cortex. Activity in primary visual area 17 may cause simple flashes of light. Activity in associated areas 18 and 19 can lead to more complex visual images that are analyzed but not recognized. Activity in higher order visual areas can result in well-formed images or scenes. Auditory abnormal sounds less common. Olfactory smelling odors that are not present, often due to temporal lobe irritation. Gustatory taste, experiencing tastes such as sweetness that are not present, also often due to temporal lobe irritation. Visceral sensations originating from internal organs. This can include feelings like nausea or abdominal cramps. The insula, a primitive cortex buried within lateral sulcus, it's a primary area for processing visceral sensations. Abnormal firing here can lead to nausea or cramps. Underdiagnosis, sensory epilepsy is often overlooked because the focus is frequently on motor seizures. Temporal lobe epilepsy. Temporal lobe is closely associated with primitive functions, olfaction and taste. Emotions regulated by limbic system, which works with temporal lobe. Memory, particularly recent memory involving the limbic system. Then it is also associated to sexual behavior controlled by limbic system and temporal lobe. Species survival and perpetuation functions like smelling, eating, and reproduction are linked to limbic system and temporal lobe. Differentiating fantasy from reality. This crucial function, which develops as we mature, is governed by temporal lobe. Sense of familiarity, recognizing familiar versus unfamiliar people and places. Manifestations of temporal lobe epilepsy. Those are olfactory gustatory hallucination, experiencing smells or tastes that aren't real, often considered psychomotor seizures due to associated psychological disturbances. Deja vu, an overwhelming feeling of overfamiliarity with a new situation, person, or place. Jamais vu, a sense of unreality about oneself or the surroundings, feeling that familiar things are suddenly strange or unreal. Jamais vu. And abnormal sense of reality, disturbed perception of self and environment, such as believing one is made of metal or cotton. And abnormal sexual activity, recurrent unprovoked sexual movements or behaviors, sometimes linked to abnormal electrical focus near the amygdaloid body in the temporal lobe. Anger bursts, sudden intense outbreaks of anger can sometimes be manifestations of epileptic seizures originating near the amygdaloid body. These can often be controlled with anti-epileptic drugs. Mood fluctuations, while not always epilepsy, extreme mood swings may be linked to abnormal electrical activity in mood regulating centers, leading to use of membrane stabilizing drugs like valproic acid, valproate as the mood stabilizers. Starring spells, epileptic twilight state, sudden staring in a particular direction, often due to abnormal firing in the frontal eye fields, causing conjugate eye deviation. Summary of the seizure types: motor, sensory, psychomotor. Motor is tonic, clonic, tonic-clonic, atonic, myoclonic, and kinetic, stopping activity. And sensory somatic, special senses like visual, auditory, olfactory, gustatory, visceral. Psychomotor often involves temporal lobe functions like taste, smell, deja vu, jamais vu. Abnormal sexual behavior, anger, burst, and mood fluctuation. Mood fluctuation and potential seizure activity. Some individuals experience significant abnormal fluctuations between happiness and sadness, often described as being very emotional or jazbati. Okay, a current theory suggests that mood regulator centers in the brain might develop abnormal electrical activity leading to these extreme mood swings. These abnormal electrical activity is why membrane stabilizing drugs, commonly used as anti-epileptic drugs, are now included in the group of mood stabilizing medications. Valproic acid, for example, is now used as a mood stabilizer, typically at lower doses than when prescribed for epilepsy. Important distinction: it's crucial to understand that mood fluctuation is not always epilepsy, although severe anger bursts can sometimes be controlled with anti-epileptic drugs. Mood stabilizers and anti-epileptic drugs due to proposed link between mood regulation and electrical activity. Mood stabilizing drugs now often include membrane stabilizing medications, which are also used as anti-epileptic drugs. Valproic acid is an example of a drug primarily developed as an anti-epileptic, but now also used in low doses as mood stabilizer. Mood regulation alone does not always indicate epilepsy, though severe anger outbursts, which are more controlled by anti-epileptic drugs, can be a sign. Type of seizure experiences, we know that. Bursts of epilepsy and frontal eye fields. A specific type of epilepsy involves a person suddenly standing still and staring in a particular direction, reminiscent of waiting at a bus stop. This phenomenon is known as burst of epilepsy. The abnormally firing area in this type of epilepsy is the frontal eye field. The frontal eye field is a cortical area responsible for eye movement. Stimulation of the left frontal eye field causes eyes to deviate to the right and vice versa. Irritation of this area can lead to eye deviation. Frontal eye field seizures, burst of epilepsy. A specific type of epilepsy involves a person suddenly standing and staring in a particular direction, sometimes mistaken for waiting at a bus stop. This is known as burst of epilepsy, characterized by abnormal electrical firing in the frontal eye field. The frontal eye field is a cortical area responsible for eye movements or ये देख लिया है. Recapping the seizure and epilepsy, distinction is important. ये clarify होना जरूरी है. Epilepsy defined as intermittent, spontaneous, recurrent tendency to develop seizures repeatedly, whereas seizures are abnormal motor, sensory, or psychomotor experiences that result from abnormal electrical activity in the CNS.